Go ahead, sir.
Hello, a very good evening to all of you. Hi, I'm Dr. Nilesh Balkawade, Clinical Head and Fertility Specialist at Oasis Fertility Pune. Today we are going to talk about why are the infertility cases on the rise? Why is it becoming necessary for more and more couples to take treatment for infertility? Basically, infertility is a problem where a couple is not able to conceive in spite of trying naturally without any contraception for 1 year. And if a couple is more than, if the wife is more than 35 years, then we say that the period is reduced to around 6 months. Uh, there are various reasons for a rise in infertility cases. If you see female infertility and male infertility separately, then age is a very important criteria for females. The age of fertility decline. So there is some age for that, and therefore, not every patient will have the same fertility over years. Uh, Basically, mm, uh, it was supposed that the fertility starts to decline at the age of 35, but if we look the Indian scenario, it can start much earlier. The age of menarche is dropping, and therefore the age of menopause is also dropping. This age of the ovarian reserve, at which the age at which it drops, is again uh, coming down. Whereas, on the other hand, the age of marriage is increasing, the age of childbearing is increasing, and this irony or this paradox has caused a problem, especially for females. So it's warranted that females do check their fertility at the age between 25 to 30 and ensure the time which they have for becoming pregnant. Again, along with this, the pollution, pesticides, plastics, all these three P's is causing problems in female fertility, and the egg number is on decline. The ovarian reserve, which is tested by AMH and antral follicle count, is on decline. Along with that, few infections are increasing, pelvic inflammatory disease or PID is increasing. Cases of tuberculosis, although tuberculosis is an old disease, again the cases of resistant tuberculosis are increasing, and all this is causing problems in female fertility in the form of uh, endometrial and tubal disorders or tubal diseases. Along with this, the lifestyle is changing, and more cases of obesity are coming up. There's increased risk of PCOS in patients of obesity, and cases of PCOS are also on the rise. So, poor ovarian reserve, PCOS, endometriosis, pelvic inflammatory diseases, all these cases are on the rise in females, and therefore the female fertility is facing some issues, and the cases of infertility are on the rise. In men, the sperm counts are on decline, and we can see many men with low sperm count, low sperm motility, and so on. Again, diseases such as varicocele, sexual dysfunctions due to stress, and other disorders, they are on the rise. Then, along with that, obesity is on the rise in men, and this is causing problems at multiple levels. So, there is sexual dysfunction, ejaculatory dysfunction, problems with the semen count, motility, and morphology, all due to obesity. Addictions are on the rise, and this can cause problems with the sperm motility and vitality. So overall, these are the reasons, and therefore we need to find out the exact cause. So, uh, as a couple, the couple sometimes has family planning on in their mind, and they are not able to conceive. They don't want to conceive in the first few years of their marriages. Sometimes the couples come to us with a history of medical termination of pregnancy. So all this has caused the fertility to be on the low, and caused the infertility cases to rise over years. We need to understand that the basic issues in men and women needs to be addressed. Secondly, the society needs to be informed. The society, there should be awareness brought about in the society to check for fertility, to be aware of one's fertility. That's very important. Sometimes the age of marriage cannot be reduced. Girls and women may have to pursue their careers, and therefore this is the time where they would like to have uh, a break from childbearing, and therefore they would want to have a delayed conception, and therefore they should check their fertility. If their fertility is on decline, then options such as egg freezing, or if they are married, options such as embryo freezing come up to us, and therefore this can help the couple. Friends, don't run away from the problems of infertility. Try to face them. Try to seek help within time. So seeking help in time is very important, so that as doctors we can help you out in the best possible way. There are certain good investigations, simple investigations which we can undertake and check your fertility, check the cause of your fertility, uh, cause of infertility, and we can treat and manage the cases accordingly. There are multiple treatment options available. We have medicines, we have treatments such as artificial reproductive techniques such as IUI, IVF, we have endoscopic surgeries, and so on in our kitty to help couples to conceive. So don't run away from the problem of infertility. Although the cases of infertility are on the rise in India, there is always a solution to it. And if we diagnose conditions within in a good at a good age, and we if you diagnose it earlier, the sooner the results will get. Thank you so much for your patient hearing. If you have any infertility related queries, please log on to call on this number or get in touch with us at Oasis Fertility Pune in our Vakkad and Kharadi centers. We'll be more than happy to answer about any queries related to infertility. Thank you.